So now we're going to do some special procedures that you may be called upon to assist with as the technician at the clinic, the spay neuter clinic. This is a cat who is a feral cat who has already been neutered. It's come to post-op, and now we're going to be doing ear tips. Ear tips are ways to identify a cat as already being spayed and neutered before it's released back out. So we want to do the left ear, so we're going to lay the cat down on its right-hand side. We're going to remove 3/8 of an inch on the left ear. So what we want to do is we want to get our hemostats. We want to see about 3/8 of an inch. Make sure it's nice and flat so it'll look nice when we're done. Once I like where my hemostat is at, I squeeze it together and I'll hear that clicking noise that maybe you heard when I did that. Once I clamp that down, I don't want to change my mind and remove it because I have bruised and damaged the skin. I don't want to move this again. That has to stay once it's there. Then I grab my scissors, and what I want to do is when I'm thinking before doing it, I want to imagine that I'm just going to cut these scissors and I'm going to get the whole thing. So what I want is I want my hand in a comfortable place. I don't want to be doing something awkward like this and finding I'm having to chip away at it. One closure. So I get it right next to the hemostat. One closure, boom, it's done. Then what we want to do is we want to take a betadine swab that we're going to put a little styptic powder on. The betadine is to clean possible infection. The styptic powder is to stop bleeding. So I'm going to roll my betadine swab in some styptic powder. Once I have that, I'm going to paint that onto the edge of the ear where I took that tip of the ear off. So that's how we do an ear tip. Now, we'll want to let this sit for about 3 minutes so that it controls bleeding and that sort of thing. So when it comes to your post-op table, you can do the ear tip, let that sit, do your vaccinations, do your revolution, and what other treatments you have to do while you're letting that sit. So while we let that sit, let's go ahead and do revolution on this cat because the menu says to do revolution. Now, with the revolution, we have several bottles of revolution. It says revolution on it, and then it usually has a group name. Today we're working with ARVS, our own group, so we're going to use the ARVS revolution. Revolution is for flea and tick, no tick control, flea control, ear mite treatment, and intestinal parasites. The dosing is written on the wall right behind on the corkboard behind the post-op table, and we'll introduce you to that dosing. But a cat this size is going to get 0.25 cc's. And when you get here, if you don't know how to read numbers on a syringe, let us know and we'll show you how to do that. What we want to do to apply this is we want to make sure that this really gets down to the skin. If we put it on the hair coat, it's not going to work. We want to be on the back of the neck. So what I do is I separate this hair out, and then I squeeze it right onto the skin. So I'm just applying that in a little streak. I got a little bit more, so I'm going to go ahead and I'm going to separate that hair coat again, and I'm going to make sure I get it right on the skin. Okay, so that's the revolution. Then I would check that off of my sheet so no one else comes along and does it. We've given this ear a little bit of time to clot, so we'll go ahead and we'll remove that. You may see just a little bit of bleeding, looks like maybe a little bit there, and that's okay, life will go on. If there's excessive bleeding, do let me know, but a little oozing is fine. Okay, so now we're going to talk about drawing blood. Van is going to be showing us how a tech would hold off a blood vessel, and then I'll be showing how we draw the blood. So we're going to pretend this cat's awake because one day you'll be doing it on an awake cat. She's going to use her one hand to hold the scruff of the cat so that the cat can't get away. With her other hand, she's going to push the leg up against the body, and then she's going to push straight down. When she does that, she's acting as a tourniquet. I've clipped a little hair on this leg so that we can see a little bit better. And when you first start doing this, it's totally fair to clip the hair on the leg to make it easier for yourself. Once the alcohol's on the leg, which lets us see the vein a little more easy, you can very clearly see that there's a nice vein there. So what we're going to do, and I am left-handed, so I'm probably not the best demonstrator of this, so you're going to do everything backwards compared to me. So with your left hand, not your right hand like me, your left hand, you're going to grab at the tarsus area, and you're going to lay your thumb down next to the vein. Okay, what I'm doing with this is I'm keeping that vein from rolling too much out of my way. Then with my other hand, which in my case is my left hand because that's my dominant hand, you will probably use your right hand, we're going to come in and we're going to draw. Now, before you do draw, what you want to think about is once that needle is in the vein, I want to be able to pull back on that plunger to fill up the barrel of my syringe. So it's a good idea to think about how am I going to hold it steady and pull back on the barrel. So think about how you'll do that, okay? Practice it. See, I'm holding it in, I'm pulling back at the same time. All right, when I feel like I'm ready to get my sample, what I'm going to do, bevel up, and you probably can't see this on the film, but there is a sharp end of the needle, and we'll talk more about that when you come in here, but you want the bevel up. You want to position about over the vein, and then you want to push in, and then you want to kind of thread it in, okay? You can see that we have a flash going on in the hub of the needle. Then I'm going to slowly pull back. Again, I've already thought about how am I going to pull back once I'm in there. I've already planned for that, okay? We need about 0.1 cc's to do a leukemia test. So then my holder would let up, and that means she'll pick her finger up so she's no longer a tourniquet. I will put my thumb over the vein, and then I'll pull out. I do this so that I don't get a lot of bleeding. And then if I had to go do something, the technician could then take over and put her thumb right over that, and she could hold pressure on that for about 30 seconds. So that's how we do a blood sample.